Hello, everyone. COVID crisis in India has brought us all to our knees, in India and abroad. There's so much of information floating around, isn't it? Most of it is from the WhatsApp university, unverified, misinformation, myths. I don't know how to deal with it at times. We've been receiving numerous requests from people asking, seeking answers for questions that we really don't have answers to. We felt it was necessary to get a medical expert on board to share their knowledge and take us through some of the common issues behind the COVID situation, specifically in India. In particular, today, we will focus on infections, how to keep ourselves safe, or if we do get infected, what steps we could take. Apart from this, there is a lot of conversation around oxygen. We've all become used to this new word, oximeter, oxygen cylinder, oxygen concentrators. What is this? Let's understand this a bit more. So today we have with us Dr. Bishwajeet from NHS Birmingham, who is a consultant on emergency medicines, to discuss in detail COVID management and answer some of our questions. Now, friends, remember that if you are sick, you do need to seek help from your local medical professional. This discussion is simply to help us understand the misinformation around COVID, and doctor will give us and will leave us with some very valuable tips. Now, anybody who is watching, if you do have any questions as we speak, please leave questions in the comments box and I will make sure that the relevant ones are answered. I'm Raga Olga De Silva, or Totally Out Now as you know me. Please join me in welcoming Dr. Bishwajeet.
Hiya. Thank you for having me. It's really a pleasure.
Doctor, thank you for accepting. I know how busy you are right now with all the things that are happening, and in your own, back home in India, in Manipur, things are not looking very good, are they?
No, it's a bit not. I wouldn't say a bit. It's quite concerning because I think the report that came out an hour ago shows an infection rate of around 20%, and that I would call us through the roof. That's very, very scary.
Yeah. So we'll come to we'll talk about that a bit more. But before we start this conversation about the COVID, specifically about India, I just thought if you can give us a brief overview about how we handled the crisis in the UK when we were in lockdown for the longest time possible. Our health system was compromised as well. So can you give us an overview on how you dealt with it?
I think it's almost a year and 3 months. The first UK patients that was diagnosed somewhere was around 27 January, and then we all start panicking. As usual, we got trained, and then we went through the first wave, and then the second wave was even harder because we're seeing loads and lots of patients, including young people. But fortunately, what I can say is in the last 3 or 4 days, the number of deaths due to COVID has decreased a lot. I think therefore yesterday was only 2. That's absolutely marvelous. So I think it is because of whatever intervention has been done, and with the public having the responsible behavior has really, really helped. So I believe it is the lockdown in a way that people doesn't meet, but if they're meeting with caution, and the vaccination has really, really helped. And I'm really glad that we are where we are today, because now we can meet people in our gardens, isn't it? So I would like to just let everybody see the difference between India and UK currently. In United Kingdom, a couple of days ago, the number of dead people was only 2. I think yesterday was 4 or 6, but we are still in a lockdown. I cannot meet my best friend inside my house. I have to meet them in a garden or in a park. But that also only one household, so I cannot meet 3, 4 friends. And despite whatever is happening in UK, the progress, things are getting better. The lockdown is there to make sure the virus doesn't win again, because we cannot let it happen. In India, I think we have to do that. We really, really have to do that. Yeah.
Sure. Just briefly tell us, doctor, when we were hit at the worst time in the UK. I mean, I remember this with so much of fear. I was sitting in fear, and the word anxiety was part of our vocabulary as well, right?
Yes.
the health system, we saw photographs of ambulances so stretched that they had patients waiting outside, not quite dissimilar to what is happening in India. Of course, in
Mhm.
India, it's happening at a massive scale. It's
Yeah.
completely out of control right now, as it seems to us from here in the UK. But tell me, what was your experience? How did you deal with the emergency then?
I mean, as an emergency physician, I think we're trained to deal with this, and this is what we are up to, and that's what we will deal with it. Um, but it comes with a lot of challenge, because what we got here is I have not seen a patient who comes with COVID infection and doesn't think they're not going to die, because everybody felt they're going to die. So it's not just managing the COVID infection, but it's managing the person as well. Then we got staff. We got lots of staff. So our hospitals were all divided into two. One is a high risk and one is a lower risk. But everywhere it's COVID. So we were trying to limit of the chances of our patients getting infected, as well as our staff. And then we got our ambulances. Unfortunately, in the worst time that you were mentioning about, we had ambulance waiting in our hospital for more than 6, 7 hours. And that was very difficult to take, because we have a responsibility to every patient, and not just the patient, the staff as well. As a consultant, you look after the whole department and the whole, so, and it was quite challenging, but unfortunately things are much better now. But yes, we're still not out of it. Yeah.
Sure, sure. So, I'm going to ask you some very basic questions. So please don't mind me. I am
Oh,
speaking
please.
from a layperson's point of view, and these were questions I wish I had answers for when we were going through this catastrophe ourselves. Why, what is COVID? What is this infection?
So it's we got lots of virus infection. We got flu. So in this one, it is because of a coronavirus. Okay, that we now label as coronavirus 19 or COVID-19, because it was discovered in the year 2019. So it's a similar virus, but unfortunately, it looks like it has come from a virus that is normally dwells with animal and then got transferred to humans. And this is why the ferocity of its infectiousness is higher than the usual flu that we are used to. Flu itself is dangerous, but most of the time we get used to it. Unfortunately, apart from those people who got immunosuppressive disorder, like people with low immune system. But with the coronavirus that we are facing right now, I think the infection is much higher, and this is what we're facing. This is what we are really struggling, because of the number of people who are infected. So if there is a town with 100 people, let's say, if there are a town with 100 people, and if in the flu season, if 10 people get infected, we can look after it. But if we got 50 people get infected, then how are you going to look after it? That's what the huge challenge. And then the other severity of it as a result of how the coronavirus affect the human system, human body
Sure.
system.
Sure. So it's like I said, step by step, so we understand COVID a little better. Now let's talk about the infection.
Mm-hmm.
So, are we too late in India? I this afternoon we spoke with somebody in India. We're speaking to multiple people. They are talking about the entire families, the entire
Yeah.
extended families being infected. It's not just one person. So if you're staying by yourself, that's one infection. But if you're staying with multiple people in the family, which is typically what happens in
Yeah.
India, we're talking about the infection is spreading. So
Yeah.
one is, doctor, can you tell us, one is simply one, if I'm not been infected yet, how do I manage? First of all, how do I prevent it? Two, if I get infected, what do I do?
I think this is probably one of the most important questions, because nobody wants to get infected. And I'll tell you, I am myself fortunate so far, despite been looking after almost, I think, 1,500 patients over the last 1 year. This is how our hospital look after. I have not been infected with the COVID-19, not infected with the coronavirus. Okay. So fortunately, I had my two vaccines, but before that, and the reason why I believe I managed to not get infected is because we do the basic things. Okay, the basic things is, how we get infected is most commonly is through our hands. Okay, now if you see in my hands, I have roll up my sleeves. So this area is exposed, and this is what we do in a hospital. We make sure everybody's bare below the elbow. So when we wash our hand, because this, if what I do is every time I touch something with my hand, okay, every time I touch something with my hand, even my own top, my jacket, my hair, I wash my hand because I don't know whether the virus is in my hair or in my top, okay? Or if I touch a door, or if I open up a cupboard, or especially in hospital, phones, computer, I'm washing my hand because what I don't want is my hand to touch something where the virus is there, and then me, without washing my hand, touch myself into my nose and my mouth, and this is how we will get infected. So, but when I wash my hand, I just not just wash the fingers and the palm, but I wash all of this.
Okay.
Now, this is very, very important because if you're wearing long sleeves, like how I'm doing right now, when you wash your hand, the virus may get here, and you don't wash this bit because this is your cloth. So this is why it's so important if you are going out, if you're in a highly infection area, high risk area. I believe in every part of India is high risk. Make sure make sure you have your sleeves up. This is especially very important for our healthcare personnel. So everybody in our hospital, everybody is bare below the elbow. The elbow is all tucked up, okay? And nobody wear a watch because a watch can, because when you wash your watches, you don't wash the whole of it. Okay, you can have the virus. So this is very, very important.
Sorry, may I interrupt here? And what
Yeah.
about people who wear gloves and say, "Oh, I'm wearing gloves, so I'm protected"?
So the gloves are important, very useful, very. So the gloves, when you are touching somebody, you pull your gloves away. But what happens is in the process of removing your gloves, or sometimes if the area which is exposed to skin here, if the virus stays over there, this is why even when we do not use the gloves, well, even after we dispose the gloves of, we still wash our hand, including our wrists. Very, very important. So this is very important. And then the next one is, suppose if I touch my hair, the next thing I would do is I wash my hand before I do this. Yeah, very, very important. So we wear a mask. That's okay. My mask protects me from somebody coughing or sneezing directly to me. Okay, but when somebody sneezes or cough and it goes to my hair and I touch this and I go into my nose, that's how I will pass infection. Other one, the important thing about mask is so important is if I get infected, it protects the people around me. So as a respect to my colleagues, to my family members, to my loved one, I will wear a mask so that I don't transmit to anybody else in case I am infected.
Great.
If we do this, okay, for somebody like myself who has worked as an A&E doctor, as an emergency doctor in one of the worst affected hospitals in United Kingdom, we know how badly United Kingdom, I remain uninfected. That means this works. And not just this, many of my medical colleagues did not get infected at all because
Great.
we do this all the time.
Okay.
And sorry, go
Sorry,
on.
sorry. So I'm just going to ask you about the mask bit because these are common things that are happening. People are sharing masks as well. Oh, you don't have a mask, take mine. Yeah, and your own mask. Do you wash it? How many times do you wash it? How do you protect? All these are basic questions. That we are neglecting basically.
So basically, if you wear a mask, just assume that it's contaminated. Now, you may still wear the mask in the future again. Okay, you may wear the masks again, but it is you already used it before. But the only thing is, if you weren't going to use a mask that you have used before, it starts smelling. It's just it doesn't. So you always use a new mask. I work in a hospital, so we've got masks all the time. That's not a problem. All right. But what I would suggest is to those who are listening, if you are going to use a mask again and again, please make sure you wash it. Because it's always nice being clean, and cleaner is better. Because you will remove your mask and leave on your table, leave it somewhere, and if it gets infected, this is how things will spread.
Okay, Dr. Bish, people like us, a lot of us are able to say afford a mask, right? Are we talking about now India? We're talking about people in India, a common man. I'm talking about a person who has no food to eat, because we're having those kind of conversations also.
Mm.
They struggle for meals. They don't have a mask. They use cloths, their
Mm.
own whatever rags that are left or cloths. Is that all right as well? Because
I
they're
mean,
also carriers, right, of infection.
I mean, the best is the surgical mask, what we call as FFP3 or N95. The best because it protects and it doesn't allow to. But it's always better to have a barrier, so it can be a cloth, it can be something, because that's better than nothing. Ideally, yes, a mask definitely. But if you do not have one, I mean, hopefully you have one. But a face covering is always better than not any covering at all.
This is so important for me. What I just gained from you in the last 5 minutes is the basic, simple thing that has protected you. Although
Yes,
you were in the throes of getting this, if anybody got it, it would be you, right? And you're
that's
saying all you did was washed until here, and you made sure that you wore a mask out of not just for your protection, but out of respect for somebody else as well. Basic things I wish my friends, and I know my friends watching this will understand and use. But tell me, once you've got infected,
right.
how do you protect others in your extended families, in your friend circle?
I think again another. Thank you very much. You asked very important questions, and that's really wonderful. So in India, or especially in the Asian community in United Kingdom, including Italy, what we found is families were getting infected as a whole. So one member of the family gets infected, the whole family gets infected. Okay, and that's quite tragic. That's quite tragic. What I think we should do is, if you are somebody who is in a high, who goes outside, who meets other people, okay, please assume that you are already infected, and you have to protect your loved ones, especially the vulnerable ones. Okay, so if you got, let's say, for example, if you're a young person and you got elderly parents or grandparents, you have to shield them, and this is how you show you care and love and respect them. And how you shield them: do not meet them. You can meet them, but in an outdoor area, not inside, in an outdoor area with at least 2 meters distance. Or other one is, talk to them by phone. Use your phone or talk beyond. You can have a windows to separate. There should be a barrier. All right. Yes, it's difficult. You want to hug them. You want to be with them. You want to have meals together with them, but you do not want any harm to happen with them. And unfortunately, we are in a difficult time, and we have to protect and shield them. And this is what we have to do.
So what
Otherwise,
happens if you're sorry? So, doctor, what happens if you're already in the house? I
yeah,
mean, you live together. You know how we live with the extended
yeah,
families in India. We don't have a choice in India. We don't
yeah.
have multiple homes, right? So, what do you do to manage that?
So if you live in a house where you cannot, shield the others, then and so it depends. If you got other family members who are not symptomatic, so they might have an infection, or they might not have it. We don't know yet. In that case, but we know that, for example, it's me, that I know that I'm infected, then I will go into a room and make sure everybody doesn't come towards me, because we need to have the spacing, that distance. Yes, it's not ideal, but it's better than not being in the same table or in the same room watching television together, what talking. But that is how we will infect each other. So whatever physical distancing that you can do inside the house, do it. That's what we have to do.
Okay, Dr. Bish, I'm going to interrupt again. And so this is again a good tip for people who can manage this, who have multiple rooms, who
Mm,
have the affordability. But I also know of some family members who've just gone and booked themselves into hotels and said, I'll keep myself safe,
mm,
protect myself and families. But I also know of families in places like Dharavi in Mumbai,
mm,
where a family of 13 live together in one room.
mm.
Now, how do we expect them to have a 2 meters distance to protect each other from this infection?
I
That's
think
a reality of India, right?
Yeah, I think that's a reality. Unfortunately, that's a reality. But unfortunately, we have to understand that whoever gets infected has to take the responsibility of saying, like, fine, I am possibly 30 or 40. I'm fine. But do I want to give this to my parents? Do I want to give to my relatives or my family members who's got cancer? Because the chances of them dying as a result of this is very, very high. And we know that that's happened.
Okay. So
So,
is there apart from these tips, is there any medication like in that specific medication that actually helped the community here in the UK that you see is also happening in India, which is very helpful? Can you
okay.
just give us some idea of that?
So with regards to medication, I think the best medicine to protect against COVID is to make yourself healthy. Okay. And the one thing that really, really helps is good food, good nutrition. Okay. Sleep well. That way your immune system is higher and better. Okay. There is no medications that can replace a good nutritious diet, a good sleep, and active physical activity exercise. No medicines can replace, and there's no medicines at all. So eat well, drink well, all right, sleep well. That is the best. And just to come back with the infection
Sure.
is one of the things that is happening in India is people are getting infected in groups together. All right. Okay. Now I told my sister, my younger sister, do not meet my parents. She's married and she lives a bit away. So do not meet them. And if there is no other way you have to meet them, you have to meet with a 2 meter distance. All right. But this is what I'm going to say is if you have neighbors and you love them very much, do not meet them. Talk beyond with a phone, but you can see over the windows. Do not meet your aunt or your uncle or your brother or your sister. Okay. Do not meet anyone unless they live in the same house as yours. That's the only way we're going to stop this. And that doesn't take money. That is doable. And I don't think we do that. We think that we can meet my brother or my sister or my aunt, my uncle. It's just a brief 2 minutes exchange of a good news or a bad news. No, this is how we get infected. And this is how people are dying. This is why people are waiting for long hours for oxygen. We have
Sure.
to take responsibility for that.
But we'll come back to this. I think it's a very important discussion because this is what is happening to our friends in India. I know for a fact all of our friends there, most of our friends were constantly interacting, meeting, partying because it had not reached them. And now look at the impact of that, the effect of that. So we are all responsible as well for this, as apart from everything else that basically fell apart, right, in India. Now coming back to this, this word, I want to kind of go into this whole thing of the word oxygen.
Yes.
I learned in school about oxygen, but the oximeter, oxygen cylinder, oxygen concentrator, I have no idea about it. Started haunting. You
Hmm.
see, oxygen lungers, you must have heard about in India, right? You've got little camps where the Sikh community is providing 20 minutes of oxygen respite. You know,
Yes.
I mean, we've come to this. So, can you tell us, one, what is this desire need for oxygen? Two is, what is an oximeter? And at what stage should we start worrying or panicking and reaching out for help?
Okay. So the coronavirus, the COVID-19, when it gets infected, it infects most of the time our lungs. Okay. But it also affects other parts of the body. Your heart, your lungs, your kidneys, your liver. So as human body, as a human, we need oxygen to use energy because without energy, we will not be able to talk, we will not be able to do whatever we need to do. And this is why oxygen is so important. When we get infected, the body works harder because there's infection followed by inflammation. So, for example, if somebody sprains the ankle, what happens? The ankle gets swollen. It becomes hot. That's an inflammation. The body is trying to heal it. In the same thing, when the coronavirus infects the body, there is inflammation as a result of it. And this is how the body copes with it. And when we do that, we need more oxygen. Many times we can compensate for it. Suppose if I got flu, there is no way I can run 100 meter or even walk a mile because the body can use the atmospheric oxygen just to sit down and recuperate. Now, when it goes to the lungs is the one where it transports oxygen. It absorbs oxygen goes to the body, and the body taken by the blood, and the blood reaches all the vital parts of the organ, including our skin, our everywhere. So we need that oxygen. But when the oxygen exchange is disturbed in our lungs, inside our chest, okay, we struggle. This is why what happens, the body says, okay, you're not getting enough oxygen. So how am I going to get more oxygen? I'm going to start breathing faster. Instead of doing the usual 10 to 12 per minute, I am breathing at around 20, 30, 40, because I am trying to get more oxygen, because the body needs oxygen. This is when we start giving oxygen for people who got COVID-19 infection, because the body needs, because we cannot keep working, breathing 40 breaths per minute all the time, isn't it? Because our work of breathing is so high, and we use more energy, and then this is how when we get tired. And when people get tired, they stop breathing. And when they stop breathing, what happens? There is no oxygen going in, and that's how people unfortunately die. So it's very, very, this is why we need oxygen. Now, there's a lot of confusion to say that every COVID infection needs oxygen. No. We know that 80% of the COVID infection will just recover by themselves, or their mild form. So what I tell our patients when I advise them is two things. So there's two ways to treat COVID infection. One is with oxygen, and one is without oxygen. And most of them, 80%, doesn't need oxygen. And who are they? If somebody can walk around 6 minutes without any breathing difficulty, and they can eat and drink well, you don't need anything at all apart from paracetamol and a good nutritious diet. The most important drug in this viral infection is good food, good nutritious diet. That is what, if anything anybody wants to take away from here, that is what I would say. The most important drug is good food. Okay.
So we're coming back to oxygen. So let's say I have the infection, I can't breathe very well, I'm having difficulty. Do I have to use a oximeter to understand my levels are coming down? When do I start worrying? When do I seek medical help? Because sorry, doctor, I'm just going to complete. A lot of people are rushing to get oxygen, and in that panic also, there's a whole lot of stress on the health system. So I just really need to know, when should I start worrying for me and my family?
Anybody who has got COVID infection and they are struggling to breathe. So when they walk around, they're struggling to breathe. This is when I would suggest that, okay, you need to be seen in the hospital. And then the hospital, if they felt that you are okay, we will, in our hospital, what we do is, if they come in and if they feel they're okay, we will send them home with a pulse oximetry. Okay. So anybody who requires a pulse oximetry, what I would suggest is they need to be at least seen, assessed, or discussed with a nurse or a doctor. Okay? Because we don't want somebody to have a pulse oximetry and not know what to do with it. Yes, many people are buying pulse oximetry at home. I think it's good. The only thing is it comes with money, and now I don't know whether there's a huge scarcity around it as well. But in those people who cannot afford a pulse oximetry, the important thing is when you walk around, and if you've got breathing difficulty, it means your oxygen levels is low. The only thing, the pulse oximetry, what it does is confirm how low is low.
Okay. Sure.
That's the pulse oximetry bit. Okay, so pulse oximetry, so what I do in our hospital is I ask them to walk 40 steps, 40 steps. And if they can't, and when they walk around for 40 steps, we check their pulse oximetry again and see whether the oxygen level comes down or not. If the pulse oximetry oxygen level doesn't come down below 94%, and if they can look after themselves at home, we want them to go home, because home is the best place to recover, to get better, because you have your own television, you have your own bed. It's much better to recover in that. That's how we've been practicing managing COVID patients who can go home, or whom we think can go home.
So what happens if you reach a point where you're struggling for oxygen and you don't get oxygen in time? Now, there are people in India who are, as we know, a lot of our friends from here are sending oxygen concentrators or oxygen, they are arranging for oxygen cylinders. Is that helpful for a home remedy, or do they need to be in the hospital?
So I think every patient that is struggling to breathe or need oxygen, they should be in a hospital or in a setting where there is nurses and doctors to look after them. Unfortunately, that is not the case in India currently. All right. So yes, an oxygen concentrator is good. Okay, it helps to buy time for you to find a bed in a hospital. Okay, so there are so many ways we can give oxygen.
Sure.
Yeah, so an oxygen concentrator is one of them. The other
Okay.
one is the oxygen cylinders. All right. So in our hospital, we got our oxygen plan, and so we will give oxygen from that main source. The only time we will use an oxygen cylinder is when we have to transfer a patient from one ward to another ward, or they're going to a CT scan, or they're going for an X-ray. When we have to transfer, because the oxygen from the main system, the main plant, you cannot move them around.
Sure.
The
So
other,
go
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 on.
on. Sorry. So no, please, Dr. Rashid.
The other one is, so this is oxygen cylinders are quite good because, but oxygen cylinders, uh, with oxygen cylinder, they got the end capacity. It's a condensed oxygen into a cylinder, and then you use that, so it doesn't last for long. It can't. So small cylinders last for 2-3 hours. The bigger cylinder lasts for 6 hours, depending on how much oxygen you're giving. So in people who requires oxygen for a long time, so for example, people with what we call COPD, bronchitis, people with chronic lung disease, lung problems, who needs oxygen at home, they are given the oxygen concentrator, because what they require is some oxygen at home, okay, and uh, and then you can have. So if suppose if you've got a cylinder and the cylinder runs out of oxygen, then you have to find a new oxygen. That's fine, but with the oxygen concentrator, it always can give you oxygen all the time. This is why oxygen concentrator is used for these people.
What is an oxygen concentrator? Sorry, if you can explain.
So what happened is with the oxygen concentrator, what it does is we got the atmospheric oxygen, okay, which is 21% oxygen, and the remaining is nitrogens and carbon dioxide. So what this machine does is it gets the air into the machine and then takes away the nitrogen and makes it more and more. So the concentration of oxygen is higher. Instead of 21%, they increase to 40%, 50%, 90%. So that's what it is. So it takes the oxygen from the atmosphere in our own room and use it to make it more purified oxygen. So that
Good.
is good. The only thing with that is there are different types of concentrator. Yeah, there is 5 liters, 10 liters, there is hospital one. So in hospital, we got oxygen concentrator as a backup mechanism. Should something happen and we need to give oxygen, or as a backup mechanism to the cylinder. So with this, we cannot give very high flow oxygen or high concentration of oxygen. So if somebody requires a 28% to 30% oxygen, a concentrator is absolutely fine. If you require like 100% or a 90% oxygen, then this is when the oxygen cylinder, or the one where you can give lots of oxygen, comes into it. Yes, you have concentrator. They can do those kinds of things, but those are for hospitals. They're big, they're very expensive. And if somebody requires 100% of or 15 liters of oxygen, then you definitely need to be in a hospital, and they possibly need intensive care unit support. Do you
Sure.
mean?
Sure.
So with the oxygen concentrator that we are getting in the home at currently, which gives around 30 to 40% of oxygen, is to buy time, or they are getting better, but not really better yet. So they need a little bit of oxygen to support. This is when the oxygen concentrator can come into it. It's very useful, it's helpful, and that allows people to possibly to go home as well, with consultation with via teleconsultation or home visit. So it gives you the opportunity. The good thing is all COVID patients are not unwell to require lots of high flow oxygen. So
Sure.
oxygen concentrator can be useful, but it has to be used in a very monitored, in an environment where people can look after the patients. It's not
Sure.
about how much oxygen they require. As a doctor, what I'm thinking is, why are they requiring this oxygen? Is it just because of COVID pneumonia, or is there something else that we're missing as well?
So for that, you need to be seen by a doctor, right? So that it can be diagnosed. So a lot of our friends, as you know, are sending oxygen concentrators back home,
Mm.
whether from the UK, from Hong Kong, Singapore, or from India itself. And I have been reading lots of messages over the last few days about that, oh, this didn't work in India, the capacity, this capacity. So, what is the minimum specification requirement that we should, when we are sending something to India, what is it that we should send?
I think it depends on what they are sending for. So, for example, if they are sending oxygen concentrator to be used for their family, say they need a bed in the hospital, but they don't have beds. They have got bed in the hospital, but they don't have oxygen. Then you need to give an oxygen concentrator that can give a high flow oxygen, because if there's no oxygen, then the better the machine is, the better for it. Um, so it depends on what the individual needs it. If it's just for home, where they feel like, look, this is just to buy time until we can get to a hospital, then it's a difficult thing to advise, because anybody can become unwell. There's no guarantee that you will get beds in the hospital. Okay, so the better, the better the oxygen concentrated, the better. But most of the time, it should be for people who require some amount of oxygen. And I would say this is for the initial stage of COVID infection, where now they are getting worried, so they have some oxygen to give while they wait for the hospital, or they're coming out from the hospital. Yes, they've been assessed, they're fine. Look, you don't need you need to stay in the hospital because you require some amount of oxygen. But suppose if they got some of that oxygen at home, and the doctor can see them in the community via, I don't know, whether face to face or teleconsultation, then it can be used for that. So it would be for specific circumstances. So any oxygen concentrator is useful, but depends on the context and where it would be used, what it should be used, and who are going to be they're going to be use it for.
Sure. Dr. Bish, we spoke also about earlier about this whole that in India, a lot of people have air conditioned rooms. I'm talking about people who have affordability, of course, in urban. And and we heard that using an oxygen concentrator or a cylinder in an air conditioned room is not advisable. Is that correct?
I don't know. You know what? I've just been looking around it, because we don't use oxygen concentrator in United Kingdom. Okay. We know it is there. It was part of our training, but we don't use it because we never had that. We never were in a stage where you had to use it. From what I can gather is you have to look at the kind of oxygen concentrator you're buying and the manufacturer advice on that and whether it can be used for that. My understanding is if it's a well ventilated room, then possibly can, but you have to check the distributor, the MAC of what is the advice of the machine. So please check the machine and get advice from the manufacturer of where can it be used and where it can't be used.
Yes, please don't go blindly and do it because it's of no point. It's no point, right? If it's of no use. But I'm just going to now go back and
And that's
forth between a few things because langar, oxygen langar, where you go in, it's like for 20 minutes or whatever time you get a oxygen given to you for a short burst. Is that helpful? Short burst of oxygen?
I mean, I think I can fully understand and I admire what people are doing to help each other out. If somebody requires oxygen and in a COVID infection, they will require oxygen for a while. It will not be for 1 or 2 hours. All right. So if they go to a place where they can get oxygen for 1 2 hours, all right, I it, it's difficult, okay, because if they require oxygen, they require oxygen. They need to be in the hospital. And if they go for 1 2 hours, but they don't, when they come out from it, they are fine. Then you don't need oxygen. You do not need oxygen for 1 or 2 hours. You need oxygen for a period of time until you get better.
Sure, sure. I mean, just thinking because they're giving, and I know why they're doing it. 20 minutes quick burst helps get your lungs
Mm.
to a certain standard, and then they move on to the next person. And I've been sitting here and wondering, does that help? What happens after this 20 minutes? until you get help after a few hours, right? So it's something that I don't have an answer for. I don't know whether anybody has an answer for that. Does it help temporarily? But
So, but what I can suggest is if this oxygen langer are there in front of a hospital, where they go to the hospital because they are having breathing difficulty and they can't wait for beds, so they probably might be useful. The only thing is, please be careful. I don't want this area to be a super spreader. Again,
yes,
so the people
yes,
who, the nice, kind, generous people who are helping them, please make sure you look after each other. Okay,
yeah,
do not get infected. Okay,
sure,
it's important
sure.
to help, but it's important to look after yourself because if you are with if you are infected, if the kind and generous persons are infected, who will look after? So
Correct.
we need to be careful about that as well.
Very valuable message. And I want to ask you other things, coming back to the infection bit of it. How There's a question from Raj Singh Rawat. He's saying, what is the shelf life of this virus in open air and in closed rooms, of course? And again, sorry, I would love you to touch upon this whole concept of in India, we shut ourselves thinking we are going to keep the virus out. Let's shut the windows, right? So, yeah,
So, you know what? That's again a very difficult question. Okay, we know that when people are indoors and when we sneeze, when we cough, when we talk, the virus stays longer. This is why the United Kingdom government is very, very keen and very strict by saying do not meet anyone indoors. Because if you meet indoors, the chances of infection is much, much higher than outside. Now, how long does it stay? There was a recent article in Lancet which talk about airborne, that COVID virus is airborne. Yes, it is, but for how long? Because what happens is it drops down gradually, or it gets blown away in a well ventilated room. So I guess it'll be around. So it's my assumption. Okay. And there are lots of papers to try and describe it. Okay. So it will be around 2 to 3 hours, but depending on the ventilation in the room. If it's a completely closed room without any ventilation, then the virus will stay there for long. So is what I would suggest is instead of trying to find out how long the virus stay, do not go into a closed room. And if you have to go to a closed room, treat as if it's a high risk area by making sure you got an appropriate mask and you're going there and coming out as soon as possible because you do not want to be exposed to the virus for a long time, as minimum as possible.
fantastic. So there is a question from Neeta Srivastav, who's joined us from Canada. She's saying, is there a medical way to convince my anti-vacciner friends? Oops.
Okay, that's fine. I mean, you know what? I think the most important thing that we have to do during this pandemic time is we have to understand each other. Yes, people get worried and don't want to have vaccine. And what we have to do during the time is we have to understand why they're saying that. Find out why they feel they don't want the vaccine. And once we understand, most of the time you can clarify and have a rational discussion around it, because most of the time is because I have seen this on YouTube or in Facebook or in WhatsApp that some guy or girl or whoever starts saying that this will alter your DNA, this will cause infertility, this will cause mass death. Okay, there has to be reason. Okay, and what I would say to Mr. Srivastava is please have a discussion, an open discussion. Let them talk of why they feel so. Okay. And most of the time you can you can understand what's going through their mind, and then you can clarify that it doesn't cause infertility. There's no evidence about it. There's no evidence that it alters your genes. So it's about that understanding. It's easy for me to say, no, you are anti-vaxxer, you're wrong. But what will bridge together and let people understand and come to the right or the most appropriate decision is the understanding among all of us.
Yeah, and like Neeta said, she's a Miss Srivastava, Neeta Srivastava.
Oh, sorry.
It's okay. So she said, someone said that they did a reaction. So when people have reaction and then people talk about it, and then it becomes bigger than what it is, and then we know those reasons. And no, that's a very good question, Neeta. Thank you for asking that. And I guess for us, until everyone is safe, no one is safe, right? That's the mantra we all follow. I believe your mother got her vaccines as well in Manipur. So
Yeah.
that's how we will protect each other, isn't it?
Yes.
That's Dr. Bish's
No,
mom.
thank you.
Yeah.
Thank you.
And
Yes.
that is how we protect each other, isn't it? And
Yes.
this one other thing that has been making the rounds quite a bit is about the plasma donation. People are
Okay.
asking for plasma. I'd love to know more about this. First of all, what is this plasma? And two is really, how does it really help us? And is it something that we really require? Does it help a COVID patient?
So the plasma is part of our blood. So the blood has many components. We take the red cells out, and then that what remains is the plasma. It's the fluids where all the blood cells floats around or goes into. The assumption was that when we have infection, we produce antibodies. That's how the body fights. And if we use that plasma for people who are having COVID infection, okay, the antibodies that's generated will help those patients. They will help to fight the virus. Unfortunately, the UK has done a trial in almost 900 patients and found that there is no evidence that it helped patients in people who are in mid to the intensive care unit. So if a person is unwell enough in United Kingdom to be in the intensive care unit, they found no evidence. So the trial has discontinued in those people who are in the intensive care unit. The trial is still continuing in people who are not in the intensive care unit but requires oxygen and hospitalization. So we got three groups of patients. One is the people who stays at home, they don't need plasma. Then you have the two groups of patients, one who needs to go to intensive care unit and the one who can be seen who are managed in the hospital wards. The trial is still continuing, but unfortunately the evidence is not very good. I think in Indian ICMR has come up recently that it's not found to be very useful.
Okay. So this plasma donation basically is the plasma camps. So right now there's no evidence to prove that it is of any use, is it? So
In
if I
the
have
in the very sick people,
in
it's
the very
found
sick.
that in United Kingdom, it's found that there is no
Okay.
evidence that it improves the mortality.
Sure. So if somebody has again a COVID related question, so I believe that now some of my friends have had COVID for the second time, not just the first once, but the second time as well. So can you get COVID multiple times? And also like first time, second time, can it be a third time as well? I mean, is there any study to show that? Number one. Number two is, does it get worse or does it get better? And three is having a vaccination. How does it help?
I mean, it's you know what, it's unfortunate that people get reinfected, isn't it? And we know that the stories about it. And when the stories comes up, it comes up big time because right,
Mm.
uh, this person got infected again. The incidence is quite low, very, very low. All right. So we're not talking about one every 100 or one every 200. We're talking about one in 100,000. So it's very less. As I said, the coronavirus is the same virus that we get flu. And how often do we get flu? We can get flu almost every year, or twice a year, three times a year. So we can get it reinfected. The good thing is that is very rare. But because it's rare, it makes more news. That's why people get to hear more about it. Yes, we can get reinfected, but please do remember it's very, very rare, and we do not need to worry about it because the experts, the scientists are let them do all the worries to see what they can do about this reinfection. For us is the important thing is to look ourselves and our family, okay, and our loved ones. And that is by making sure we're eating, drinking well, and sleeping well, and having good nutritious diet, and wash your hand.
Mask. But there's a friend of mine, doctor, who's had COVID, and the entire family has been stuck with COVID. She's recovering, still not tested negative. She said, "How do you?" She's a singer. She's a performer, Sonam Kalra, and she says that it really hurts her when she tries to even do rehearsal, right? So practice. So she says that, how do I keep my lungs oxygenated, and so that the infection doesn't set in?
Okay, so the lungs will get oxygenated regardless anyway. Okay, so when you breathe in, we get oxygenated because that's how we survive. Otherwise, we will not. Um, but depending on the degree of infection, degree of pneumonitis or infection in the lungs can get injured. Okay, this is why the long COVID symptoms are there. But most of the time, they get better. It can take up to a few weeks to a few months, but they do get better. What the person can do to get better is to do exercise. Suppose if I don't run the marathon, and if I try to run the marathon next week, there is no way I could do it. But if I practice for it every day, and then probably in 3 months' time, 6 months' time, I can run the marathon. And this is what we should do with our lungs or people who are recovering from any disease, including COVID infection. You do exercise gradually and build up gradually. That way, things will get better. I know a friend of mine, an anesthetist, who took 9 months to get better, but he is absolutely fine now. He's the same age as me. He got unwell. He stayed in the hospital for 3 days, but it took a while for him to recover. But he did recover because he kept doing exercise gradually every day, little by little. But now he can run very, very well.
So patience and faith is what we have to believe
Yes,
in, right? And that brings me to the next question on this whole concept of happy hypoxia.
yes.
About the young. Can you explain what this means? This has been again the buzzword for the last few days. Just explain this concept of happy hypoxia and the young ones getting this.
Okay, so happy hypoxia is, I'm not sure how many people are happy to get COVID infection, so I don't think anybody's in happy. But the concept comes from somebody has got low oxygen levels, but they look okay. They're smiling. They're trying to communicate with the family. They're trying to talk. So what happens when they come to the hospital? We find that, oh my God, their oxygen level is quite low. So how come is it that they got low oxygen levels, but they were not aware that they're unwell? So that is why we felt that this is why the term comes in, like they look happy, but they're quite unwell. So happy hypoxia. Hypoxia is decreased oxygen level. Now, most of these things are found in people who can, what they call it, compensate for a long time. So young, fit people who's got the reserve to compensate despite being unwell. Okay. Now, I don't think any one of them will be able to walk around well. This will be when they are just sitting down or lying in the bed. That they cannot that they find it very they don't find themselves very, very unwell, or they don't find it very short of breath. Okay. But the moment they walk around, they will become short of breath. Okay, so these happy hypoxics will not be able to walk around for long. This is why it's so important. If you are isolating at home or you are recovering at home, you have to walk around at least 4 to 5 times a day. One is to build your reserve, to make yourself better, because when you walk around, it's better. The second thing is to see whether you are becoming worse or better. If you can't walk around 40 steps, 40 steps, ideally 6 minutes, okay, then it's time to get medical help.
Excellent. I mean, these are just such simple things that we've understood and learned from you, Doctor, today. I'm just going to see if there are any questions, any more questions people have. I mean, people are complimenting you for this amazing conversation. Anamita Goswami, thank you. Manoj Gulshahani is here. He's one of our friends. We're doing a session with him tomorrow. Very interesting session with him, Dr. Bish. He's from Mumbai. And, last year during lockdown, we all talked about food, migrant workers, right? There was a scarcity of food, as you know, and people and essential supplies. So people like Manoj, they did a lot of work in Mumbai. Again, we've forgotten that people still need food to eat. There is
Yes.
lockdown, apart from all the oxygen and the medical issues that people are facing. So tomorrow I'm going to have a conversation with him and one of his volunteers who is fully visually impaired, can't see, comes from the most humble background you can imagine, but the effort of these people in bringing Mumbai back to its heels, it's amazing. So they're feeding Mumbai basically.
Oh, great.
And yeah, and I'm looking forward to that conversation. And so he's here as well. We've got Meenal Jaiswal. So anybody who has any questions, we'll be here for another 2 minutes, a few minutes. Please let us know. I've personally learned a lot, Dr. Bish,
Okay.
from you, because there is things like proning, for instance. Can we just have a conversation
Yeah,
about
sure.
proning? Yeah, does that work? And
No,
at
no.
what stage does it help?
So proning means when we, most of the time, we sleep on our back or on our sides. So proning means when we sleep on our tummy. So we normally sleep like this. Yeah, this is the face, okay, and this is our front of the tummy. In proning, we sleep the other way around. This is we found. So what we do in our hospitals, anybody who comes with COVID and they go low oxygen levels, we prone them, because what happens is if you see yourself, your chest, the lungs are smaller in the front. The lungs are bigger in the back. So when we lie on our tummy, the bigger part of the lungs is in the front part. Yeah. Okay. So that's the lungs bit. Okay. So when you have a bigger area of the lungs where oxygen is coming in, you can get more oxygen in instead of the smaller, because with the gravity the air goes up anyway. So when we prone, the bigger area of the lungs gets more oxygen, so they're able to absorb more oxygen. Other thing that we found is when you prone, people get more secretions, and these secretions are, if they stay in the lungs, it can cause blockage of your air sacs of your lungs. The bronchi and bronchioles. We call it alveolar. The air sacs. So this is why we found proning to be very, very useful, and we prone everyone. So if somebody is unwell, please prone. Now, this proning cannot be done in people who's got big tummy or they're pregnant. You can lie on your side, absolutely fine. So you can lie on your side for 2 hours, 1 hour, half an hour, keep changing. What we're trying to do is use every part of your lungs. Instead of lying on our back or sitting down, you're just using front part of the lungs. So we're just trying to use all part of the lungs by lying on the side, by lying on our tummy. That is what we call as proning. Very useful. Please use it. But if you need proning because your oxygen level is low, we need to find out whether is it just the COVID that's causing the low oxygen levels, or is there something else, like a collapsed lungs, like a clot in your lungs? Because that's very, very important. Whether somebody had tuberculosis in the past and it's getting worse, so we need to do that assessment. So proning is good. Please do prone if you feel unwell and your oxygen levels are low, but you need to get medical help and assessment.
Uh, Thank you for that. And doctor, there's one more question from Neeta Srivastav. She's saying, should we still wash and sanitize packets of groceries?
Okay. No, don't do that. I have never done it. I have not washed any of my groceries, any of this for the last 13 months, ever since COVID has been there in UK. And there is hardly any evidence that it transmits things. Unless, of course, somebody coughs on it right in front, in this. But I don't wash them. And many of my colleagues feels that the risk of transmission from these food products are quite minimum.
So Neeta, I hope that answers your questions. I also sometimes wash because you don't know
Yes.
open vegetables. Like you said, we are not aware of how many people are coughing on it, right? But yes, packed items I don't really normally bother.
Can I just add something? When you wash them, what happens is if you're washing them, the air bubbles coming out, and that will cause, if there was virus, it will start filling up part of the area as well. So we call it. It can cause aerosol generating. It can be an aerosol generating procedure. So just be careful about it as well.
Doctor, I cannot tell you how thankful, how grateful I am for this
Fine.
conversation with you. Seriously, I consider myself, like I said, as a person who doesn't really understand medicine at all. If I have fever, I take a Panadol. That's the maximum I know. And there were so many myths. We are part of many groups. I've myself been receiving in the views room, that we run. We're receiving hundreds of messages, and people WhatsApp groups giving tips. This is what you do, what you shouldn't do. All of us have become experts and doctors. So it is so good to actually get a real expert who knows his subject and who understands, and you've been through it. to share your expertise and knowledge with us. I'm really grateful. Is there any advice you want to give our audience before we end the session?
So just to come back again, we need to stop this virus. Okay, the government can say that it's a lockdown, but if we meet people in our neighbors, our friends, our own families, we will not be able to stop the virus spreading. So whether the government announces whether there's a lockdown or not, because of the number of people who are getting infected, please do not meet anyone else apart from your own house. Do not meet your neighbors. Do not meet your brother again. I'm just going to say it again. Do not meet your sister if they live in a different house, or your best friend. Talk to them over your phone, because that is not just how you protect yourself, but that's how you protect them as well. We need to do this at least for the next few weeks until things get better. Okay. Otherwise, it is such a heart-wrenching, heartbreaking to see what's happened. But we can do it just by not meeting anybody. And if at all you have to meet outdoors, not inside the house. Meet outdoors with the 2 meters distance, with masks on, and we can win this. Thank you.
Excellent. So we are talking about being me responsible. Let's
Yes.
say me responsible, not you responsible. It is me responsible. And thank you very much, Dr. Bish, and the audience. If anybody has any further questions for Dr. Bish or for the Views Room, please write to us at theviewsroom@gmail.com. Remember what we said when we started the program, that we have taken an expert on board to talk about various issues connected with COVID management. However, if you are sick, if you have any symptoms, please reach out to your local doctor for any medical help. So thank you for joining in. We will be back tomorrow, same time, with Manoj Gurshahani and our friend who's a volunteer. Look forward to meeting you again. Thank you again. Signing out, totally out now. Thank you, Dr. Bish.
Thank you very much.